Hello everyone, I am Dr. Surbhi Kapoor, Consultant Geneticist Hegde Fertility. Today we will discuss on much needed topic. Everybody wants to understand what is preconceptional genetic counseling, what is preconceptional genetic screening, how this preconceptional genetic counseling or preconceptional genetic screening has become an important part of pregnancy planning or a health of an offspring. Now we are living in a scenario where couples are well educated, lot of information is available on the net, they Google, they understand. So the young couples especially, they are very clear that they want to plan one child, but that should be a healthy child. They want to understand that there should not be any increased risk of passing any genetic disease from the parents to offsprings. There should not be any, they understand that if there is any miscarriages in the family, they just want to understand why it happened, or will they be on the increased risk of having that miscarriages and all. So here comes a role of preconceptional genetic counseling. Preconceptional genetic counseling is a process in which individual or couples meet genetic counselors before planning a pregnancy. Genetic counselors help couples or individuals to understand their medical history. They take out a detailed family history of the couple and help them to understand if there is any increased risk of any genetic disease in the family, or there is any increased risk of miscarriages to the couples due to the genetic abnormality. So in this, in the preconceptional genetic counseling sessions, the couples are being educated, they are made aware what are the risk factors, what is the role of family history, what role of inbreeding in the how consanguineous marriages, how inbreeding in the family can lead to an increased risk of genetic diseases in the family. In this preconceptional genetic counseling, the couples help couples to make an informed decision to plan their pregnancy, to understand if they are at the need of undergoing any genetic test, any preconceptional genetic screening to minimize the risk of transferring a genetic disease to the offspring if their family is having an increased risk. For example, there are many consanguineous couples that comes nowadays, they are coming for preconceptional genetic counseling. As they understand, reading a lot of information from the Google, they understand that they might be at the increased risk of having an affected child, or there might be an increased risk of transferring a genetic disease to the kids if the parents are carrier. So in this scenario where we are living, preconceptional genetic counseling plays an important role. It just helps patient to understand that these are the basic steps, these are the basic thing that they cover. We take a detailed family history from the couple up to 3 generations. We check out whether there is any consanguinity in the family, or there is multiple consanguinity in the family, that this couple is at the increased risk of transferring a genetic disease, or if there previous any family history of any genetic disease in the family. For example, there is intellectual disabilities running in the family, or any sort of anything is in the family, then there can be an increased risk where couple should get screened. So this preconceptional genetic counseling help couple that they should undergo this particular genetic evaluation to understand whether they are carrier for any genetic disease that can cause an increased risk in the offspring. And if they understand that there is any increased risk, they can make a well-informed decision. They can plan their pregnancy via prenatal screening at 16 weeks, or they can opt for other options available nowadays, like they can plan their pregnancy via ART. They can go for the pre-genetic testing of the embryos to minimize the risk of transfer of an embryo that is affected. So this how preconceptional genetic counseling and preconceptional genetic testing help patients to plan a pregnancy in a way where they can minimize their risk of any genetic disease transfer to the child. Thank you everyone. Hope this session was pretty informative for you all to understand the need of preconceptional genetic counseling and genetic screening. Have a good day.